Great. So we're going to get started. Many thanks for joining us. This is the session, which is focusing on our learning from Start Fund COVID-19. And joining me is David. Would you like to introduce yourself, David?
Yeah, hello everyone. My name is David Burtz. I'm the manager of the Start Fund's Monitoring, Evaluation, Accountability and Learning team.
And I'm Lucy Puentes, and I currently manage the Start Fund. Great. So maybe just before we get started, if you'd like to add your name and the organization with which you're affiliated in the chat box, that would be great. It's also the best place for you to put your questions during the session. David and I will try to respond to as many as we can towards the end of the time we have together. Just a quick note to remind you that this session is being live streamed on Facebook and it's also being recorded. So please just be mindful of that as we go through. Great. Shall we move to the first slide, David? Wonderful. Oh, could you go back one, please? Thanks. So thanks for joining us today. Today actually marks 6 months or thereabouts since Start Fund COVID-19 was launched. And some of you might be familiar with that mechanism and others might be relatively new to it. So we're just going to briefly walk you through what happened earlier this year when the COVID-19 pandemic was declared by the World Health Organization and when Start Network launched its response to that pandemic. So just briefly to recap, the pandemic was declared on the 11th of March, and immediately following that declaration, the Start Network team brought together Start Network member agencies, so representatives of the NGOs that comprise the Start Network, and also our existing and current donors to the Start Network. And we consulted with them about the possibility of us responding to the pandemic, utilizing the speed and efficiency with which the Start Fund and other mechanisms sitting under the Start Network have become known. As an organization, we felt that it was imperative that we respond to the humanitarian crisis as it unfolded, and the Start Network member agencies agreed with that position. We were fortunate in as much as we have some very supportive donors that support us, and IKEA Foundation actually contributed seed funding, allowing us to work with the members to launch something called Start Fund COVID-19, and that launched on the 2nd of April. The purpose of Start Fund COVID-19 was to meet NGO needs on the front line of the pandemic response in low and middle income countries, and to enable local level action, specifically in neglected or underfunded aspects of the broader response, and to ensure that they were able to implement anticipatory actions as well as response actions. David, if you could just move on to the next slide, we can talk a little further about what that actually meant. So at the beginning of April, we launched a call for alerts. Some of you might have participated in that process, but basically it meant that many Start Network member agencies worldwide came together with other organizations across 69 countries to coordinate something called crisis alerts. And those crisis alerts are basically a summary of the situation in the local context in responding to COVID-19, so outlining the humanitarian impacts of the pandemic and identifying how Start funding could mitigate or respond to those humanitarian impacts in that particular geography. Over the course of a single weekend, we actually received 85 crisis alerts, which was unprecedented in Start Fund history. And member representatives then came together to review and activate a number of those alerts with that IKEA funding that I just mentioned. A few weeks later, we were able to launch a second call for alerts with funding that came through from Avaz Foundation and other private trusts and foundations. And with that funding, we tried to learn from the previous round by targeting a smaller focus group of countries that hadn't been responded to with START Fund COVID-19 previously. The second call included dedicated funding for newer members of the START Network membership, joining through 3 of the START Network hubs in India, Pakistan, and the Democratic Republic of Congo. Many of the organizations who were able to access START Fund COVID-19 in those 3 hub countries were newer members to the START network and were eligible for dedicated sums of funding that we enabled through the tiered due diligence framework that we have been piloting over the past year plus. And the tiered due diligence system is effectively a way in which we are trying to broaden access to humanitarian financing by enabling organizations, particularly local organizations, to access START funding with slightly lower international compliance requirements than is otherwise required. And we do that with the support of some of our existing donors. Until now, we have dispersed just over 5 million British pounds across 43 separate projects in 25 countries with START Fund COVID-19. We have just recently had the news that the German Federal Foreign Office is also contributing additional money to START Fund COVID-19. So in the coming weeks, we'll be looking at how that's best dispersed to meet the ongoing humanitarian requirements for COVID-19 across the START Network membership in the countries in which they're operational. If we could move to the next slide, please. Just a couple of notes for those of you who might be less familiar with START Fund COVID-19, but might know a little bit about the Global START Fund, which is the flagship program for the START network. We have a way in which we try to disperse funding to the NGO members of the START network in a way that is fast and efficient. And that is through this alert cycle that you see in front of you now, where we really prioritize coordination, but also speed of assistance and protection to people affected by crisis. So we adapted that alert cycle slightly for START Fund COVID-19. We piggybacked off of the existing alert cycle, the existing START Fund mechanics, but we also recognized that it needed some tweaks in order to be suitable to respond to the pandemic. So for instance, we lengthened some of the alert cycle timeframes. We had to reduce the cap of the funding amount that was available to START Network member agencies. That was partly driven by the funds that we had available to us at the time. And we also introduced midterm project check-ins with colleagues that were actually working on the responses. So we tried to learn as we went, because this was new territory for us and for many of the START Network member agencies. And so those learnings that were harvested through those check-ins are going to inform what David Burt is going to walk us through in just a moment. Before we reach that part of the presentation, if we could just skip on to the next slide, please, David. One other thing that we did with START Fund COVID-19, which was a departure from our way of working under the Global START Fund, was to learn from the past disease outbreaks that we've responded to and to try to integrate a blended approach of crisis anticipation and response. And that was in recognition of the fact that many agencies at the front line wanted to implement early humanitarian actions before perhaps the virus had actually reached very vulnerable communities, but they also wanted to allow themselves space to actually respond because there was the expectation that the virus was going to start to appear in those communities, and they needed to be well positioned to initiate a fast response, but also to put in place anticipatory mitigation measures prior to that happening. We utilized something called Global Forewarn. For those of you who may not have attended the session earlier today, Forewarn is an acronym for Forecast-Based Warning Analysis and Response Network. We have a number of these at local levels, but we also have a global Forewarn community, and that includes a thematic subgroup that's focused on disease outbreaks. That subgroup includes epidemiologists, disease outbreak experts, and a number of other individuals with specialism that was able to be introduced in the decision-making processes, so that we had an additional layer, an additional lens, if you like, of expertise that would help the START network member agencies to determine which crisis alerts ought to be allocated funding as a priority, and really just to help make sure that the process was as robust as we could possibly make it upon launch. I am now going to hand over to David Burt, who will talk us through some of the learning that has come out of Start Fund COVID-19 to date.
So Lucy, hi everyone. As Lucy mentioned before, if you have a question at any point during the talk, please pop it in the chat and we'll have a few minutes at the end to respond. And I'll move to the next slide. So we've got some various topics about lessons that we've had from the COVID-19 responses. I'm going to talk a little bit about vulnerable communities. The Start Fund COVID-19 was based on the was based with the niche in mind, and based on the assumption that vulnerable groups would be more likely to be exposed to COVID-19 and also more likely to be harder hit by the impact of COVID-19. So we designed this funding mechanism specifically to focus on typically vulnerable communities, such as internally displaced people, refugees, migrants, and marginalized groups, people often living in overcrowded settings that lacked access to services and reliable information, and that face difficulties to meet basic needs, as well as communities that were in geographically remote areas, as well as border communities where there was also relatively lower capacity and infrastructure to prevent community transmission and respond to the virus. In terms of just a couple of examples, in Colombia, there was a consortium project led by HelpAge International with Humanity and Inclusion, which supported households with older family members and people with disabilities from migrant and host communities. It was noted that older people in the target area already faced significant challenges meeting basic needs before the pandemic. And for example, 78% didn't have access to clean water, and the majority of respondents to the survey did not have access to sanitation facilities, which were both essential to support hygiene practices that could help prevent COVID-19. The picture on the left is of an older gentleman in Palestine, in the occupied Palestinian territories. Oxfam and their partner Ma'an Development Center supported people who were struggling due to COVID-19 restrictions in maintaining livelihoods. They identified female survivors of gender-based violence, households with child protection concerns, and female-led small businesses to receive cash transfers to help them sustain their livelihood activities during the restrictions that were put in place in Gaza. If I move on now to the underfunded aspects of national responses, this was also a gap that the Start Fund COVID-19 aimed to fill. Across contexts, across countries, national COVID-19 preparedness and response plans were generally underfunded. Start Fund COVID-19 projects were able to support critical aspects of national responses for which significant funding gaps existed. These gaps in preparedness and response plans often overlapped with the previous topic of gaps in support to vulnerable communities. For example, in Lebanon, a Start Fund COVID-19 consortium led by Relief International specifically supported the pre-positioning of isolation centers for refugee communities. This was because the Lebanese government strategy to respond to COVID-19 specifically targeted Lebanese citizens, and they requested non-governmental organizations and the international community to be responsible for the treatment of refugees, which led to a significant funding gap for the pre-positioning of isolation centers that were for refugees. Some members emphasised the importance of reinforcing the work of national governments, in particular when it came to risk communication and community engagement, RCCE. This picture on the left is of a project in Haiti. In Haiti, Mercy Corps, Catholic Relief Services, Christian Aid, and Humanity and Inclusion, in partnership with a private technological company, Viamo, focused on the underfunded aspect of national COVID-19 contingency response plan, focusing on behaviour change, communication, and community mobilisation. And their approach complemented the government's by focusing on at-risk populations and on stigmatization associated with COVID-19. If I move on to the secondary impacts of COVID-19, again, across contexts and countries, there's been major concerns about the secondary impact of COVID-19, in particular for communities that were already vulnerable prior to the pandemic. COVID-19 related restrictions on movement and public life, including the closing of businesses, shops and markets, had and has or have far-reaching consequences, especially in terms of food security and livelihoods. These consequences were already visible when projects were started in April and May, and we've heard from the START Network members across the globe that they expect these to be further exacerbated over the course of this pandemic. In Timor-Leste, there was an Oxfam consortium project, and they noted in a rapid food security assessment that 81% of the surveyed households reported restrictions around COVID-19 had affected their food and income sources. 75% of the households indicated that more than one food and income source had been affected. And the consortium project notified us of the concerns that the COVID-19 response may lead to less attention to other pre-existing problems around malnutrition and maternal health. Additionally, in Colombia, the Help Age International Consortium project, they supported caminantes, which is a term which refers to Venezuelan migrants who travel by foot to other countries in South America. At the time of the project, there were people both leaving Colombia to return to Venezuela and people exiting Venezuela to come to Colombia as a result of losing sources of income and being evicted from their houses. As the informal sector was severely affected by the COVID-19 lockdown in these countries, many small businesses closed and street vending was prohibited. So one of the ways that the project supported people was by providing food packages for the journey, as well as providing meals to meet immediate food security needs. If I move on to coordination and collaboration during these projects. From the outset of the Start Fund COVID-19, we encouraged members to coordinate their alert and proposal development with other national and local partners. And coordination and collaboration in this context has taken several different forms. Many members indicated extremely close coordination with the government, as you may expect, various agencies and departments, as well as the United Nations, including the WHO, the World Health Organization. As we've seen in Haiti and also in Laos, the reach of existing government COVID-19 messages was amplified through Start Fund COVID-19 projects by ensuring these messages or information sharing approaches were tailored to the needs of specific vulnerable groups. In Laos, this was done through the provision of translation services for minority languages. Start Network members also coordinated through their cluster systems in country, which helped avoid duplication. For example, in Burkina Faso, coordinated with the health cluster to determine which health centers would be supported with equipment and capacity development. In South Sudan, a project led by Solidarité Internationale, they were the only WASH actor in their implementation area. So they led the WASH cluster in that region and coordinated closely with the Ministry of Health. In terms of collaboration, it's worth noting that Start Fund COVID-19 projects have been jointly implemented more often than regular Start Fund projects. Some 85% of the projects that were funded were implemented by multiple Start Network members. Some 63% were implemented by a member in collaboration with one or more local or national partners, and 37% of the projects subgranted funding to local national partners as well. It's just worth noting that these percentages are higher than what we've seen during the lifespan of the Global Start Fund. If I move on now to adapting ways of working. Many members indicated they had to significantly change their approach to large-scale activities such as distributions, community gatherings, and even training sessions because of the restrictions and measures to keep communities and staff safe, such as maintaining sufficient distance or wearing personal protective equipment. Often this meant breaking activities into smaller ones, and subsequently the time needed to complete them was longer or required more resources. For example, in Burkina Faso, the government put in place restrictions which allowed only 50 people to assemble at any one time. So in order to deliver over 9,000 WASH kits within the project timeframe, Acted, Solidarité International, Oxfam, Doctors of the World needed to identify additional sites for distribution and have 2 distributions per day, so that when people attended the first distribution, the people who attended the first distribution had left by the time the people arrived for the second distribution. This allowed them to complete the distribution of these WASH kits in time and reach the necessary number of people. Additionally, in Libya, the International Medical Corps conducted training for health clinic staff in smaller groups to ensure sufficient distance could be maintained between the participants. And they also mobilized additional medical coordinators to ensure extra trainings were completed in time. In many contexts as well, members switched to remote means of implementation for their project activities or to a mix of direct and remote. In Peru, Save the Children had to consider how to best deliver cash transfer for cash transfers. Because the team could not access communities directly, their implementing partners chose digital cash transfers. And for this, the consortium of agencies in Peru partnered with the National Bank to deliver faster and more efficient cash transfers. And this was the first time that they'd implemented cash programming in this context, in this area. It was also worth noting that many members faced significant challenges procuring hygiene items, personal protective equipment, infection prevention control equipment, and other relevant materials. In many contexts, procurement took longer than expected, especially when items had to be imported and prices either skyrocketed or fluctuated, and procuring in bulk was not always possible due to high demand. In addition to transportation delays and permits and ensuring that drivers across borders were tested with COVID-19 tests. Some Start Network members were able to avoid or overcome these challenges. In Sudan and South Sudan, for example, they prioritized local procurement of hygiene items to avoid restrictions on interstate travel. And other members, such as Oxfam in the occupied Palestinian territories and Save the Children in Bosnia Herzegovina, indicated that framework agreements had made procurement easier and faster. Okay. If I move on now to the adapting, monitoring, and accountability services. With respect to monitoring, many members opted to use phone-based approaches to gather data. In Peru, Save the Children noted that all the monitoring for cash distributions of the consortium were done via online surveys using Kobo Toolbox. Links were shared with all targeted households, and the surveys covered satisfaction with the support received. And all the consortium members used the same survey to streamline the data being collected. In terms of, accountability, generally feedback and complaints channels shifted to remote options as much as possible. In order to minimize interaction with communities and minimize the risk of transmission. Hotlines were promoted more, as well as email and social media to share feedback and complaints with members. After we reviewed the final project reports, some 74% of the projects used phone numbers and hotlines as the main method of complaints and feedback. In Laos, Care International and Plan International had limited access to the remote communities that they aimed to reach. And they switched their satisfaction surveys to remote ones over the phone to be able to gather people's feedback and information channels that they had developed and broadcasted. And this was typical and similar to other remote complaint and feedback mechanisms that were conducted through the Start Fund of COVID-19. So that is a very brief whistle-stop tour of some of the lessons that we've had across the COVID-19 responses. So now I'll open the floor and we'll welcome any questions anyone might have.
David, Inga from CordAid shared a question, well actually a request for you to share the percentages you mentioned for collaborations and subgranting to local actors in the chat so that everybody has that information.
Yeah, can do. I'll do that now.
Great. Does anyone have any questions they would like to ask? Actually, sorry, Fakri from Save the Children had also asked a question in the chat. In comparison with other start funding allocations, has there been an increased level of flexibility from the donors towards a COVID-19 response? One of the principles that underpins the global start funds, including Start Fund, is the principle of flexibility. And so we work with all of the donors that join us to instill a level of flexibility and delegation of authorities to the Start Network membership. And that was a principle that we applied when we developed the COVID-19 funding mechanisms. So the consultations that first took place with Start Network members in March gave a clear steer as to how we needed to devise Start Fund COVID-19 in terms of tweaks and changes to the Start Fund mechanisms. Some of the things I mentioned earlier in the call, like changing the timeframes within which we were working, changing the sums of funding that was available to individual member agencies. Those were the types of things that were altered, and the donors were supportive of that. I probably ought to mention something that I think has been mentioned in the chat, which is we've had a number of donors supporting Start Fund COVID-19, and some of which include German Federal Foreign Office, the UK Department for International Development, or the then UK Department for International Development, IKEA Foundation and Avaz Foundation. Maybe one thing of interest is that we actually found that trusts and foundations, and perhaps the non-traditional donor base that doesn't typically sort of make up the support to the Global Start Fund, were the main donors who had interest and were able to, I guess, pivot and respond to something like COVID-19 at the very beginning. So that was a learning from our side, the importance of diversifying our donor base to enable us to make these sorts of strategic changes in response to the situations as we see them evolve. Does anybody else have any questions? Otherwise, as we're approaching the end of our time slot, maybe just one thing to mention is that there's going to be a session tomorrow, a build session tomorrow, where we're going to review a piece of work that's been led by development initiatives to landscape the financial mechanisms and fund-like instruments who are enabling NGO responses to COVID-19, but also to other disease outbreaks. And the purpose of that exercise and further consultations with Start Network members and donors is to decide what direction Start Fund COVID-19 ought to go in, whether it still has an added value to the humanitarian system, or whether it needs to evolve or change in order to contribute to the ongoing pandemic response, or indeed future disease outbreak responses. So if you haven't registered for that, I don't know, you might still be able to get a place. Otherwise, we'll be sharing the findings from that piece of work in the next Start Fund committee meeting. And we'll make sure that the information is also circulated across the network if there's interest in accessing that. Great. So that session tomorrow, Lucille is just flagging in the chat, is at 10:30 a.m. UK time. And if you have any further questions, feel free to get in touch with either David Burt or myself outside of this session. Thanks for joining us.
Yeah, thank you, everyone. Feel free to reach out with any questions you may have about anything we spoke about today.